Now, in the wake of the largest diphtheria outbreak globally, the Nigerian government, through the Nigeria Center for Disease Control and Prevention, has said it is intensifying efforts to curb the spread of the disease and tasked media to play a critical role in the fight, especially with Nigeria at the epicenter of the crisis. The Director General NCDC, Fedayo Adetifa, alongside the Executive Secretary of the National Primary Healthcare Development Agency, Faisal Shaibu, during a one-day diphtheria media orientation session in Abuja, emphasized the importance of countering disinformation and addressing vaccine hesitancy prevalent in Nigeria. Benedict Uko has more on this report.
7 states, Borno, Yobe, Jigawa, Kano and Kaduna, have been heavily impacted by the diphtheria outbreak. In a bid to address the pressing public health concerns associated with the outbreak, the Nigeria Center for Disease Control and Prevention, in collaboration with the National Primary Healthcare Development Agency, supported by UNICEF and other partners, have engaged journalists across these affected states, including other states, on public health sensitization workshops on the need to broaden their knowledge on issues about diphtheria outbreak. Speaking during a one-day diphtheria media orientation session, the Executive Secretary of the NPHCDA, Faisal Shahib, represented by Aisha Abba, emphasized the objective of the workshop was to combat misinformation and disinformation surrounding the disease. She provided updates on the outbreak response, highlighting the challenges posed by vaccine hesitancy.
We all know that there are lots of issues going on. Apart from the disease burden, we have lots of rumors and misinformations that are going around on the vaccine, and it's really affecting the acceptance. So we have to agree within this meeting. We agree with for the roles and responsibility of the media. Started this fight since early, I think in September. But the results show the suboptimal coverage. Due to what? Due to hesitancy. There are a lot of hesitancy, which is being fueled by a lot of rumors and misinformation. So it is therefore imperative that we all put our hands together to see that we ensure that all Nigerians are protected against this deadly disease. And also this misinformation and rumors and then theories on conspiracy are also dragging the whole program down. So we have 2 main challenges here, not only on the disease, but also on the rumors that are going on. So we have 2 main challenges that we have to fight. So for that reason, we want to educate you and orient you that we have a particular vaccine that we can use to reduce the rate of transmission.
Also speaking from UNICEF, Margaret Adaba Soyemi urged journalists to move beyond headline reporting and engage in human interest stories.
This is the largest outbreak of diphtheria that the world is witnessing in many years, and it is happening here in Nigeria. So it is very, very important that you also understand that your roles are very critical as our media partners. The period we're in now, this quarter, the last period is where a lot of, diseases really start spreading, from measles to meningitis and so on. So it is very, very critical that we partner together as one, to educate the public. And one of the charges I want to give you as our media partners is to try and move beyond the headlines. If we stop only at the headlines, we're not helping our colleagues. We shouldn't just make one announcement and that's it, right? Because when did this outbreak start? People are still dying, okay? Kids are still dying.
The engagement outlined objectives to improve media knowledge, define media roles in the outbreak response, and identify areas of media support in the active vaccination campaign and other healthcare interventions.